Other thing about professional development is that you become the expert. You want to specialise. If there's an area of sports physiotherapy, sports medicine, if there's an area of being a practitioner in sport, you start out like a funnel and you look at all the things that you've done and you think, oh wow, that needling, that dry needling was so interesting. You know, I've done the Pilates now and wow, the needling is so interesting. I want to go in deeper with that. And you go in deeper until you've learned everything about that. Until you've learned everything that you are utilizing to help your patient or your athlete. But you become the expert. You are able to specialize in it. And you become that person where when people think, oh, dry needling? Yep, I need to see them. Wow, they've done all this training in it. They are the specialist in it. Now that is just a small topic like needling. You can become a specialist in a certain body area. You can be a specialist in pain. You can be a specialist in solving problems for athletes. You can be a specialist in a certain sport. The world is your oyster. And I think this is the beauty about being in this profession that we're in. You get to choose, and you don't have any constraints. You get to create your magic. So how do you do this? How do you improve your professional development skills? Things I'd recommend: you read, watch, and then you contact. There's plenty to read out there. There's so much stuff on the internet that you can read. There's so many journals out there, and even now there's so many journals that are available online. Okay. Watching, once again, internet. There's a lot of stuff like this, which I'm doing with you right now. There's a lot of internet, web-based programs. So yeah, watching is one factor, or the second part to this. The second, sorry, I'm getting everything muddled up. Apologies. The third thing is contact. If you are on LinkedIn I highly advise, because you're able to connect with experts around the world. All you have to do is send a person a message on LinkedIn, or connect with them first and say, someone would say to me, Kusal, I'd loved seeing the 4 essentials about being a wonderful sports physio. Can you expand on something? And then I'd say, yes, I'd love to expand. And then you learn. Okay? So making contact is one of the big ways, and I highly recommend it for young practitioners, because it allows other practitioners to notice you, but it allows you to become better at what you are in a shorter period of time. In Australia, they recommend 100 professional development points per year of professional development. So what that means is every hour you read a book or on physiotherapy, or something to do with helping your athlete. It might be a treatment technique, it might be an assessment technique, it might be something to do with the way you analyze problems. It could be something to do with clinical reasoning. Excuse me. Every hour that you do something gets added to, it converts to a point. Some things that are accredited can be double the time, I believe. So if you've spent 1 hour doing a certain course, because it's accredited, you might get 2 professional development points for that. What they recommend is 100. What I recommend is 200 a year, because you're always thinking about doing the things that you love. If you're doing the things that you love, it doesn't feel like it's tedious. It doesn't feel like it's too hard to work. I have averaged anywhere between 350 to 375 professional development points over the last 15 years. So, I mean, I'm very proud of that fact, but it never felt like work because I was always intrigued. I always wanted to learn everything about sports physiotherapy. When I graduated, I loved sports physio. I only ever wanted to work in sports, and I only ever wanted to work in outpatients. One of my first jobs over in Singapore, so I graduated in Melbourne, from the University of Melbourne, and I got a job in Singapore, and they said, oh, do you want to work in inpatients or outpatients? I said, whoa, wait, I don't want to work in inpatients. I want to work in outpatients. And that's how it all started. And I just went and did all the stuff that I loved. And if there's one thing I can share with you, do the things that you love, because if you love it, it doesn't feel like work, and you're going to learn, and your mind is like a sponge. You can get in a lot, and you can just make a difference. So yes, that's an example of what I did, and I'd recommend at least 200 hours a year or 200 professional development points a year. That will help improve your professional development.